Well, good morning or good afternoon, depending upon where you are. My name is Leslie Mader, and I work with InnovAge as their strategic account executive for Colorado and Virginia. And we work very closely with housing authorities, those folks serving seniors. And so we work closely with resident service coordinators. We want to help educate and let you know about the kinds of services we provide. And today we'll be focusing on dental care. I think you'll really enjoy what Dr. Earle has in store. Can we hear in the chat how many of you are new to these presentations? If you would just let us know in the chat box, that would be helpful. And I'll let Dr. Earle decide how she wants to handle questions. We'd love to have interaction, and I think there are no bad questions or even comments. So please feel free. Oh, great. Do you say Nakia? Am I saying that correct? Where are you from, Nakia?
My name's Nakaya, and I'm with the Chico Rancheria Housing Corporation in Chico, California.
Oh, great. Well, welcome. I am going to, let's see, I think, Nina, were you going to start doing the slides? I just have one slide. Many of you have attended these presentations, and I've had a pretty lengthy explanation of what a PACE program is and what we do. I have a one slide for those of you that have been a part before. I just think it's helpful for folks to understand what the PACE model can do for an older adult. And so we'll just go through that very quickly, and then we'll let Dr. Diane Earle get started. So Nina, are you going to be able to, do I need to share the screen? Because I have it if you want me to. Yep, there we go. Great. I'm going to get rid of that. Okay. So I'm not sure how to move this around, but I'll do this. Okay. Okay, for some reason, it's not letting me push the slide forward. Can you do the next slide, Nina? Thank you. Okay, so I just want folks to know PACE is a national model of healthcare. There are over 270 PACE programs in the United States. Unfortunately, it only serves about 60,000 older adults, and it's a really great model of care for lower income seniors. And so I really urge you to look and see if you have a PACE program in your area. It is funded through Centers for Medicare and Medicaid for adults that are 55 and older. And the whole goal, we think of it as a skilled nursing diversion program. It's really to help older folks stay out of skilled nursing. I always like to say, who grows up wanting to go live in a skilled nursing home? No one does. So you always want to stay in your own house, apartment, wherever you're living. Maybe you're living with family members, but to remain independent. And the PACE model really provides these wraparound services that help kind of buoy older adults up and keep them more independent. And we do that with a interdisciplinary team of 11 folks from different professional backgrounds. Today, you're going to hear from a real key one. As you know, seniors really struggle with their dental care. And so that's really exciting that we're going to get to hear from Dr. Earle. But really, PACE programs it's a social model. We have centers. PACE programs have centers. And in there are dental clinics, day centers. They get food in them, interact socially. There's a medical clinic for primary care, and rehab is always a part of that program when you go into a PACE program. So anyway, that's my real brief overview. Transportation is really key. We provide transportation to and from our site. Dental care, as I mentioned, there's a day center. And there's just so much more that goes into it. So if you're really curious, put something in the chat and I can reach out to you later. So I will read a brief introduction for you about Dr. Earle, and then we'll let her get started. So Dr. Diane Earle is convinced that better oral health helps improve general health in all age groups. She's a general dentist with over 40 years of successful service in private practice, large group practice, and clinical operational management on a national level. Dr. Earle has been with InnovAge nearly 3 years in the role of Vice President of Dental Care Services, where she is focused on propelling dental teams to excel in high quality and compliant care in accordance with recognized professional standards and guidelines. The dental department at InnovAge collaborates with primary care to improve whole health outcomes for our participants. So we really thank you for being here with us today, Dr. Earle, and we'll look forward to hearing from you now. Thanks.
Thank you. Thank you very much. Leslie, thank you for the invitation to speak to the service coordinators. Remarkably, thank you for the opportunity to raise awareness of the importance of good oral health for senior adults. National Dental Health Month, Dental Hygiene Month is October. So I don't know if this was intended for you to coordinate with the month of October. So today's presentation is actually very timely. Good oral hygiene, which is an essential component of our overall well-being, is one building block of a healthy lifestyle. According to the CDC, oral diseases, which range from cavities, gum disease, and oral cancer, can cause debilitating pain for millions of Americans. And if any of you all have ever suffered with a toothache or problems with your gums, you certainly know how uncomfortable and painful that can be. So get this, there's a growing realization that comprehensive health care requires that the mouth needs to be put back into the body, and that oral health affects more than just your teeth and your person's smile. So we'll go through some of these oral health problems with our older adults on the following slides. Seniors are at an increased risk for all sorts of changes to their teeth and jaw bones as they get older. We will discuss some of these changes as a result of untreated tooth decay, gum disease, tooth loss, oral cancers, and chronic diseases. So on this slide, you can see, I think we're on slide 4, right? Yeah. As seniors age, you can go to the next slide. As seniors age, the enamel on their teeth wears down. So the enamel, of course, is the outer layer of your tooth that makes your teeth look white. As you get older, as I said, the enamel wears down and it exposes the soft dentin layer. This dentin layer, which is the second layer, inner layer of the tooth, makes the teeth more susceptible to staining, sensitivity, and decay. You can actually see in the pictures below how several of the teeth look darker than they probably did when they were younger. I think one of the pictures shows that a patient maybe had a crown, and those crowns are whiter than the natural teeth. And that's because the dentin layer, which is the soft inner layer of the tooth, is more yellow in color as compared to the enamel. And so this dentin layer will make the teeth more susceptible to staining, sensitivity, and decay. So here's some important statistics. Nearly all adults, in fact, 96% of adults ages 65 and older have had one cavity. 1 in 5 have untreated tooth decay. And more than 64% of people older than 80 have root surface cavities due to the gingival recession, dry mouth, less effective oral hygiene, and a diminished motor skills. Many older adults have difficulty chewing and shifting, and often shift their diet to those soft, simple sugars, which produces heavy plaque. When dental plaque is not removed in a timely manner, the bacteria in the plaque actually causes tooth decay and gum disease. Here's an interesting statistic also. Older adults develop cavities at approximately 1 new cavity per year. I can say that when we see our participants in our dental suites at InnovAge, it's remarkable. You know, we'll clean their teeth in May and then schedule them back in for fillings like within the next couple of weeks. And we often see the same amount of plaque that were on their teeth when they came in for the cleaning. So they have the less ability to clean their mouth effectively. And that's due to really their diminished motor skills, but it's also because maybe nobody is there helping them with that toothbrushing process. Dental conditions that are associated with aging also cause dry mouth, such as medications that they're taking. This also contributes to the root surface cavities, periodontitis, loose fitting dentures, and difficulty eating, speaking, swallowing, and tasting. So you can see on this picture, on the slides, the cavities that are right along the gum line. We call those root surface cavities. And that's where the plaque accumulates heavily if it's not removed on a timely basis. Of course, breaks down the dentin layer of that tooth, causing the cavities. Oftentimes these cavities get so deep, it actually causes the teeth to break off right there at the gum line. You can go on to the next slide now. When plaque grows around the teeth, it inflames the gums and it causes a condition we call gingivitis. This will often result in bleeding, pain, and discomfort for our participants. When this is left untreated, gingivitis progresses to a condition we call periodontitis, which often has outward signs of abscesses, as you can see in that middle picture. This also makes the resident's breath smell bad. If plaque is not controlled, it will lead to mouth pain, eating problems, actually behavioral problems, and many medical complications, including a risk of dementia and heart problems. Patients with cognitive loss have difficulty expressing that they have pain in their mouth or jaw, which can lead to agitation and aggression, which are the behavioral problems that I mentioned earlier. It can also lead to depression and withdrawal. Most residents, when they can visually see how their mouth looks, they're embarrassed, they don't want to smile. They actually will hold their hands up to their mouth oftentimes, but it can lead to depression and withdrawal. Infections such as in gingivitis and periodontitis, these need to be treated by a dentist where we can prescribe antibiotics and pain medication over the counter. But the main objective of treatment for periodontal disease is just adequate and thorough toothbrushing and oral health care, removal of that plaque on a daily basis to make sure that the gums can get some relief there. Oftentimes we have patients or their caregivers who are concerned because, well, when I brush my mom's teeth or my participants' teeth and gums, they actually start to bleed. Well, that is a fact. The gums will bleed if they are brushed, but that doesn't prohibit you from brushing them gently with a soft toothbrush. Just use the soft toothbrush, dampen it with water, put a small amount of toothpaste, and just gently rotate the bristles of the brush right at the gum line so that you're adequately removing that plaque. When plaque remains on the teeth for an extended period of time, it actually becomes what we call tartar, which is a harder substance than plaque. So the tartar would have to be removed by the dental professionals. You can't remove tartar once it gets that hard with just a toothbrush, but you can remove the plaque with just good gentle rotation of that toothbrush. So even if you're noticing a little bit of bleeding on the gums, that's okay. It's important to remove that plaque on a daily basis, at least twice a day. And then make sure that your resident gets to see a dentist to remove any of the harder substances and to evaluate to see if the participant needs to have antibiotics or over-the-counter pain meds. Okay, we can go on to the next slide. So nearly 1 in 5 adults ages 65 and older have lost all of their teeth. That's a daunting statistic. Complete tooth loss is actually twice as prevalent among adults that are 75 or older compared to those that are 65 to 74 years old. So the older a patient gets, they're more likely to have complete tooth loss. Having missing teeth or wearing dentures can affect the nutrition because people without teeth or with dentures often prefer soft, easily chewed foods instead of foods such as fruits and vegetables. Among older persons, tooth loss has been shown to be associated with both weight loss and obesity. And that's because of the dietary choices that patients have to make when they don't have teeth or if they are wearing dentures. Just be aware of the signs of mouth discomfort during meal times for patients. Refusing to eat or maybe a pained facial expression while they're eating may indicate that that they're having mouth pain or that their dentures don't fit properly. One of the two health conditions that actually causes tooth loss is diabetes and osteoporosis. Most of you are very familiar with diabetes and what it can do to the gums and jawbone. Uncontrolled diabetes causes the gums to be inflamed. It causes problems that lead from gingivitis to periodontitis. And that, in fact, will cause the teeth to become loose. The teeth can actually fall out or have to be extracted. With osteoporosis, this is a condition that causes the bones to thin and weaken. This can lead to jawbone deterioration and bone loss. Consequently, the loss of bone density in the jawbone can lead to periodontal disease, tooth loss, and will actually affect denture wearers. So I'd also like to point out that when patients have teeth removed at an earlier age, the longer they are edentulous or with missing teeth, the greater probability that they're going to lose the bone that's in the jaw. So you'll actually see these very thin, fragile jaws in a lot of our participants. That's also exaggerated, especially if they have osteoporosis. We can see patients that actually have lost so much bone in their jaw, both top and bottom, that it makes making a denture fit very difficult. There are some surgical procedures that can assist us with a patient retaining dentures. It's called implants. But I wanted to make sure that you're aware, you've probably seen edentulous patients that their jaw actually collapses, the lower jaw extends forward, and that's because they have lost so much bone. It makes it very difficult for them to wear dentures. Chewing with removable dentures is really only about 30 to 40% efficient compared with chewing with natural teeth. When I was in private practice, I never forget, so many patients thought that, well, my mom and dad wore dentures, I'm probably going to wear dentures too, so just go ahead and take all my teeth out. And I just always encourage them, let's save as many teeth as you can so you can hold on to your teeth as long as possible. It's not easy wearing dentures. I would also emphasize that dentures are not a replacement for teeth. They're a replacement for no teeth, and there's a big difference there. A lot of patients are discouraged and feel like, well, these just don't feel like my teeth. And that's because they're not. They're just a replacement for no teeth. So we can go on to the next slide. Certainly, I'm not trying to gross you all out with any of these pictures. I tried to be very selective when I chose the pictures for this presentation, since probably many of you are not dental clinical providers. Oral cancers of the mouth we call oral or pharyngeal cancers. They're primarily diagnosed in older adults. The median age of diagnosis is usually about 62 years. Uniquely, pain is usually not an early symptom of oral cancers. So because participants generally don't have a pain in these early stages of cancer, they may not bring it to your attention. But it actually results in probably a 7-week period before cancers are actually diagnosed. And during that 7-week period, of course, the cancers can get larger and spread. Observable signs include swelling, red or white patches on the inside of the cheek, maybe the inside of the lip. The most common place where you'll see an oral cancer here in the US is on the tongue. Some of the most important risk factors of oral cancers are tobacco use, and alcohol abuse. We also see oral cancer developing when there's chronic irritation. So if a patient has a broken tooth that's constantly irritating the side of the tongue or the inside of the cheek, this chronic irritation can also lead to an oral cancer. Oral cancers are also quite common with those who have very poor oral hygiene, viral infections, and also poor nutrition. So when the caregivers are assisting the patients and the residents with toothbrushing, it's important to pull the tongue out, similar to you see the picture to the right side. You just take a piece of gauze, wrap the gauze around the tip of the tongue, and you can extend the tongue to the right or to the left. You may be able to see and observe an oral cancer or area similar to this. You would also just want to take a look on the inside of the cheek, pull the lip out, look down into the vestibular folds, and oftentimes you'll see lesions that look suspicious. That's certainly a very good reason to alert their primary care physician, and then of course schedule them with the dentist. From there, we will probably get a biopsy taken of that area, and if it is confirmed that it is an oral cancer, then we would get the appropriate treatment done, which often requires chemotherapy, radiation therapy, or surgery. Unfortunately, a lot of these cancers are observed late in their stages for the same very reasons that we talked about earlier. You know, these usually are not painful at first. Sometimes the patient can be embarrassed because they know it's there, but they keep their mouth closed or keep their hand up to their face or something like that. And so when they are treated, we have to do major surgical interventions, and we then would have to make a prosthesis like a denture that would maybe cover an area that had to be removed extensively because of surgery. So just I guess my parting statement here with oral cancers is just to make sure that the caregivers are observing and taking the time to look inside of a participant's mouth on a regular basis. Hopefully, caregivers are there to assist with their toothbrushing, flossing, and mouth rinsing. But when you're doing that, of course, observe inside the mouth as we just discussed earlier. All right. I don't know if you have any questions that you want to stop me at this point, or I'll go on, but we can take questions at the end as well. It's a quiet group. All right, let's go on to the chronic diseases. So most elderly adults suffer with some form of chronic disease. There's a strong association between poor general health and poor oral health. People with chronic diseases may be more likely to develop gum disease. We call that periodontal disease. And they are also less likely to get dental care than adults that do not have these chronic diseases and conditions. Rates of complete or partial tooth loss are higher among adults with arthritis, cardiovascular disease, chronic obstructive pulmonary disease, diabetes, and blindness as compared with persons without these conditions. So again, the emphasis here, when a patient has a chronic disease, they're more likely to not get the dental care that they need, and those their oral health conditions actually deteriorate. This group also reports that their lives are less satisfying because of poor oral health. Older Americans take both prescription and over-the-counter drugs. Many of these medications actually cause dry mouth. We call that xerostomia. Because of the reduced blood saliva flow, it increases the risk of cavities and causes difficulty in just wearing dentures. Saliva is just an important lubricant in our mouths that helps us to eat. Of course, it assists with tasting of your food. If a patient is wearing dentures, saliva is important to help with the suction and to keep the denture in place. But when patients suffer with dry mouth or xerostomia, it makes wearing a denture more difficult. It makes their chewing of their food more difficult if they have some form of some teeth. It also causes more cavities to develop right at the gum line. We talked about that in the earlier slides. One of the other conditions that poor oral health is linked to is pneumonia in older nursing home residents. We often see this when a patient aspirates saliva. That saliva is full of bacteria if they have advanced periodontal disease, and that can lead to pneumonia. So that's another thing that you would need to look out for as well with your participants. I'm so used to, Leslie, I'm so used to saying participants because that's what we call our participants, but I think most living facilities refer to them as patients. So I apologize if I say participants, is kind of like etched in my brain.
Well, and then they might want to say residents. So it's kind of, I think we all know who you're talking about.
Okay.
Yeah.
So we can go on to the next slide. So just kind of in summary, let's just summarize a few facts. Oral health is an often forgotten modifiable risk factor. So what do we mean by that? It's modifiable because if there's intention behind taking care of a resident's mouth and oral health, it's something that can be what modifiable meaning we can do something about it. It's not something that is a given that every patient has to have poor oral health. There is certainly factors that go into making sure that the patients have great oral health, but it takes intention around it. There has to be a schedule of cleaning the mouth, helping the participants understand how important it is to brush their teeth. If they have motor skill deterioration, that has to be done for them. Flossing of the teeth is also important. It helps to remove those tooth particles and food particles between the teeth. And it also helps to remove the plaque that you'll see on the teeth. It really takes about 6 minutes to do an adequate job in brushing a resident's teeth. Brushing, flossing, helping them to use a mouth rinse. Unfortunately, most patients in nursing homes only get less than 1.5 minutes of oral care. And surprisingly, sometimes that doesn't even happen. So again, that 6 minutes is kind of a time period that I think you all need to understand as far as making sure that the patients are getting the proper oral care that they need. Oral health is disturbingly misunderstood or neglected in general, and more so in elderly patients that have dementia. You all are the caregivers, so you know how difficult it is sometimes to manage a patient with dementia. It's almost like working with a child. Prior to me coming to InnovAge, I worked with an organization where I was in a leadership role, and we took care of pediatric patients. And there's just so many similarities in convincing a child to open their mouth or cooperate or allow us to do dental care. And very similar to what we're seeing when we're here at InnovAge. We have to be gentle with them. We have to explain every single step when it comes to what we're going to do. And you have to say it more than once. Like we say, tell, show, do. This is what I'm going to do. Show them what you're going to do before you actually do it. So finally, on the last slide, do you have it up? Yeah. It's so important to make good oral health a priority for our aging seniors. Good oral care is imperative for good health, overall health. One of the statements that we hear is that eyes are the window to the soul. Well, a dentist can look in a participant's mouth and really understand what's going on with their overall health. Oftentimes we can see things that are happening with the patient with their general health just by observing what we're seeing in the mouth. So it's very important to be able to establish a dental home for your elderly residents. That's one of the things that I felt so important about, that I felt was so important with InnovAge. I was so glad to see that dental was part of our all-inclusive care. I know some programs don't have dental services directly in their programs, and most of that has to be sent out. Most of those cases have to be sent out to dentists in the community. But at InnovAge, I'm just really grateful to know that most of our centers have dental care services within our facilities. In our Colorado facilities, we actually have dental suites, beautiful dental suites, where our participants can come in and see our dentist. Some of our East region centers in Pennsylvania and Virginia, we contract out for dental services. So some of those services are done within our facilities, but we may also contract with dental providers in the community that we can send up participants to. So that's really kind of the presentation in total. I'm very happy to be able to share this with you. Please don't hesitate to raise your hand or take yourself off mute, ask questions. I wanted to be concise with our timing, but certainly leave you all plenty of opportunities to ask questions. It just takes one question. So I have a question for this group. Have you all experienced observing mouth sores in patients' mouths or in your residents' mouths? Maybe they were or were not oral cancers, but is that something that you're familiar with or have seen? I see Lavana raised her hand. So go ahead and take yourself off mute and just tell me what your experience has been. All right, so I guess Lavona is just saying, yes, she has seen that. Maybe you're hesitant to share actually what you have observed. Tell me this, if anybody can just kind of give me their experience. Oh, I'm muted. Can we take them off mute? Can you take everybody off mute?
Just 1 second.
Okay. Okay, are they able to take themselves on mute now?
Not sure.
So Jacqueline says, many of our residents have dentures. And that's true, you know, 60 to 70% of the patients that we see have some form of edentalism, either complete dentures or partial dentures. Uniquely, you know, we'll see a participant in our center. We go through 5 steps of preparing and making the denture for our patients. It takes about 5 steps, and there's usually a 2 to 3 week period between those steps because the lab has to actually complete the lab fabricated portion of that denture. Once the patient has had the dentures delivered, you know, that kind of completes that process. We usually like to see the patient 2 to 3 weeks after they have had the dentures completed, just to evaluate it again, check to make sure everything is fitting well, making sure there's no denture sore spots, and that the patients can chew with their dentures in place. And then we usually like to see them at least annually to observe that. But I can tell you so many times, we'll deliver a denture case in the dental clinic, and we'll see the patient back in 2 weeks, and they can't find their denture. They don't have their denture. So I'm sure you all have experienced that as well.
Lavana said, I was going to share that I was a part of the senior oral health subcommittee for our county, and we concluded that having insurance, access to services, and bad oral health does not seem to get older adults to dental services. We are innovating by bringing mobile dental hygienists to our building.
No, that's good.
Great.
That's actually very good.
Mm-hmm.
Having it part of our services that we offer is just really important. Making, just taking all obstacles out of the way so that our seniors can get good oral health.
So Kimberly is asking, I believe, living in affordable housing at times cost is the issue. Are there national low-cost opportunities?
There
And-
are. Oh,
go ahead.
so I'm not aware of every opportunity maybe in your local communities, but there are dental offices and probably even hygiene services that will provide care at costs that similar to what we would be compensated for Medicare or Medicaid. Medicaid really, because most Medicare plans do not cover dental, but Medicaid does. Mm-hmm. Most states have preventative care included in Medicaid. So, that would be the route that you would take. And as somebody mentioned, having a hygiene service coming into your facility really removes the obstacle of, I can't get to the dentist.
Mm.
Do you,
That's a really searching your account. Oh, go ahead.
Sorry, I was gonna say, do you guys want to maybe explain a little more about how someone might access the InnovAge model of care that would include the dental assistance that you guys are presenting on today?
Sure. I think the last slide had an 800 number that you're welcome to call. We're in Pennsylvania, Virginia, New Mexico, California. If you go on to, I think the last slide had said, I don't know the number by heart, Nina, but I think it's 866. I don't know if you can find it.
I just put it in the chat.
Oh, thank you. Perfect. Yeah, you want to call that number and you can find out if your apartment that you're with is in our catchment, or you can also go to npaonline.org. That's for the National PACE Association, and you can pop in your zip codes and they'll tell you what the PACE programs are in your area. So that's another thing to do to try to find. But I was also going to say, I think most counties through either Medi-Cal or Medicaid have some type of dental program. So it's just kind of doing some research in your area.
Right. I like the comment that Lavana made about that most seniors can trust the professionals that come in because they trust her. And that is important. We partner with several mobile dental providers. In fact, I went to evaluate and visit with one group last week here in the Denver area. They'll bring their complete, like a complete dental clinic into your facility. It's remarkable. But they can provide these services at your locations so that when they're familiar with the staff there in your facility, oftentimes the staff will help to coordinate care for the patients there, and it does build trust. But these professionals who are committed to providing oral care for seniors are, wonderful. They're great caregivers. They have a tender heart for patients that are suffering through some of the, chronic diseases that we mentioned earlier on this presentation. And they know how to take care of patients that have varying levels of cognitive ability. So I certainly would encourage you to reach out. I know that I've seen mobile providers that do oral care for seniors in most states that we operate in. It's just a matter of, kind of finding that link.
Lavana, I was just reading your comment, and I think whoever you end up contacting to come to your building, I think it's really important to emphasize who the what the population is like that you're dealing with. And then I would even interview them and find out, do they have the awareness to be more gentle and kind to folks with trauma? I don't know. What do you think, Dr. Earle?
So trauma triggered by tapping to professional face. Yeah. So I mean, all of our oral healthcare providers, our dentists, our dental hygienists, and dental assistants at InnovAge go through extensive training on caring for elderly adults with, conditions very similar to what you're talking about there. Maybe they have experienced trauma in the past, but oftentimes their level of dementia, just makes them feel like somebody's attacking them if they're, bringing something closer to their mouth. So I mentioned, similar to what we have done with children, with pediatric patients, you have to take the time, tell them what you're going to do, show them what you're going to do before you actually do it. Tell, show, do. So we'll maybe have a model of a stuffed animal that we're going to kind of tell them what we're going to do. We're going to open your mouth. You're going to take a toothbrush, brush the teeth. We have, a lot of the teams will have like a stuffed animal that actually has a denture in their mouth. It's really kind of cute. And they'll actually show and demonstrate what it's going to look like, or what it will feel like for them to brush their teeth. And you do it close enough to their face so that they can see it. And then you just kind of slowly bring your toothbrush to the patient's mouth. You start with toothbrushing. I would also always encourage caregivers to start with toothbrushing. That's the first kind of the soft line of care. But our hygienists that come in and provide care, of course, they're going to use instruments and maybe a polishing disc. But they start with a toothbrush just to introduce that to the patient. Any other questions?
I just wanted to comment, Dr. Earle, that it was really fascinating to me to hear about how oral health can really affect someone with, their dementia, but other, heart. It's part of the whole system, isn't it?
Yes,
And
exactly.
that was really helpful. And I'm just wondering if you have any suggestions. You gave really good examples of, older adults covering their, their mouths with their hands. Even just like how to have the conversation. If you could just comment quickly about how would you bring that up to someone who might be embarrassed about the way their mouth looks, to try to introduce them to the idea that they should get some dental health.
Okay. One of the things that we found to be very helpful, and we did this a lot while we were closed during the pandemic, we prepared oral hygiene kits for residents. We sent them out to the residents' living facilities, and we provided them with, oral hygiene kits like a toothbrush, toothpaste, floss, mouth rinse for those patients that we knew had dentures that we had a history of seeing. We sent them a kit that had a denture brush, denture paste, all the types of oral care needs that they would need to take care of their mouth if they're wearing a denture. So really kind of sharing a denture, an oral care kit with all of your residents is the first step, because it kind of opens up that door to saying, this is something that we're providing for you. We feel is necessary. You could also have oral health care professionals to come into your facility and just do kind of a simple talk like what I'm doing here, but maybe demonstrate. In one of our centers this past month, our dental team dressed up kind of like in Halloween costumes, but it was a toothbrush, a toothpaste. They had these dental focused costumes on. And they just did a presentation for the residents right there in our facility, in the day room. Well, something like that might be able to be done in your facilities where they're kind of, everyone is exposed to the importance of oral care. So if you do it in a large group setting first, I think that's the first entree. And then if you have specific residents who need special care or need prompting on, let me take a look at the mouth, then it kind of at least has opened up and warmed up the, their thought process to say, okay, well, maybe I'll just let somebody take a look in my mouth. But it really just takes a gentle touch. Sometimes you have to be very persistent. I've seen where our professionals will actually go to the sink in front of the patient, just go to the sink and show them what they're doing, how they're brushing their teeth, and then hand a new toothbrush to the resident and say, okay, show me how you brush your teeth. So again, that's kind of the tell, show, do. And then as they're brushing their teeth, the dental professional can go on, put their gloves on, and just kind of look in the participant's mouth while the patient is brushing their teeth. So it's just a really kind of a soft way to be able to take a look and see inside. But you have to do it incrementally, kind of breaking down those barriers and helping to develop the trust. You might not be able to get a lot done on the very first visit, but by the second and third visit, you'll probably be a little bit more successful.
Thank you. That's great.
Okay.
Well, go ahead.
So I guess just back to that last slide, is establishing a dental home for your residents is very important. That way they are consistently seeing the same team. If they're going out to the dental provider's office, they're more familiar with that team. Or if you have somebody coming into your facility, again, that would be considered a dental home. So that's what I would say is the thought that I would want to leave with you is making sure that you are finding that dental home for your residents.
That's great. Well, thank you this was really informative. Really appreciate the presentation. So
I hope I didn't throw you out with the pictures. I tried to be very selective. Nina,
Yes.
any other questions or anything else that you have?
Not that I can think of. I will definitely share the PowerPoint and link to the recording once it's uploaded so that anybody who wasn't able to attend today can gain access to the information that you shared. And thank you guys so much. I appreciate your time and it was a wonderful presentation. Thank you to our members for taking the time to listen today and to be engaged and ask wonderful questions. And Lavana, thank you for all the resources and things that you were able to share from your side of things. We appreciate it. With that, I think we're good to go. Thank you.
All right, bye-bye.
Thank you. Take care.
Bye.
Bye-bye.